Hello, here, Lukas, who you already know, most likely, and today your favorite physiotherapist, hopefully your favorite, will show you how to stretch safely after the open heart surgery. Now, I am 6 weeks after the surgery, and I can do much more than in the second week. But what I will show here should be safe for majority of the people after a week after having a surgery. Now, obviously, there is no rule that says that it will help everyone, and it's simply because every case is different. Every case requires a little bit different approach. What I can do and it's helping me can harm someone else, and it all depends on the physical activity level before the surgery, overall health, medications someone's taking, and that is why treat these stretches more like a suggestion. And if you have any doubts, consider asking your doctor or a physiotherapist before performing them. Obviously, there are few rules that needs to be used to keep those stretching sessions safe. First of all, we cannot stretch the chest muscles, we cannot stretch the chest too much. I'm not really sure how the situation looks like if only the part of the sternum was open. I guess there is still a restriction in the stretching of the chest of the pectoralis muscles, those big guys over here. I had the whole sternum cut, so in my situation I need to be 100% safe, so no stretching here. There is no tragedy if I rotate a little bit around, but throughout the day I move a little bit like a robot, so I keep my ribs and pelvis stuck with each other, so they work in most of the cases together. When I open the doors, when I push something, when I bring something up from the floor, chest and pelvis, they move together to keep as much stability as it's possible. And I don't move very much far behind with my shoulder and up. My full range of motion of the shoulder flexion is somewhere here. If I try to move more, I feel unstable, I feel that it's risky. The leverage is not convenient right now. So only the stretches that are not disrupting the scar area. Now the second rule is that stretching is not actually lengthening the muscle. It's training of the nervous system. When you do a plank, when you are on your elbows, on your hands, you feel that your stomach is trembling, and if you will do 2 or 3 rounds of that, the next day you will have DUMS, you will have soreness of that muscle, which is a normal thing. As you know, this soreness disappears after a few days. Then you do the exercise again, and you can handle the exercise for longer. Amazing. Stretching is the exact same type of contraction like abdomen during the plank. The fact that you feel pulling, it's not because the muscle is being stretched, but because the nervous system contracts the muscle. Your nervous system fights with you, is not allowing you to get to a certain position because your nervous system is not used to being in that position. Now, if you stretch too much, you will have DUMS the next day. And normally it's not a problem, but after open heart surgery, something that I painfully realized is that throughout easily the first month, you cannot have any sign of inflammation in your body. You will feel it a lot in your heart. If you will lead to that, the next 2 days will be a bit tough. So the stretches are very gentle. 2, 3 out of 10 in the scale of intensity seems to be safe. Now, obviously, this situation will not last forever. I'm not sure how long it will last. Right now, I'm not pushing myself more. I'm giving myself time. And it's very easy to get DUMS in hamstrings muscles. And that's why always consider 2, 3 out of 10. If it's letting go, then you can push a little bit more to get again this 2, 3 out of 10 experience. Then again, if it's not relaxing, just stop. Don't overload yourself. It's not the time for this. Obviously, stretching is amazing because it's very low intensity, it's very gentle, and after leaving the hospital, it helped me a lot to get back the sense of my body. After not moving for so much, after being drugged with so many substances, I was pretty floaty, let's say. My nervous system was a bit anxious, even not a bit, I would say moderate, and moving my body helped me a lot. So I really hope it will help you too. Now the stretching, I will start with my wrists and my ankles, and it may be weird for a lot of people, but the reality is that in your wrists and your ankles here you have so-called retinaculum. Retinacula is extremely innervated, and mobilizing those areas decreases the tension in your body globally. So just by stretching those four, you already have some relaxation happening. So let's stretch those and let's take it from there. Let's start with the wrists. Elbows straight, and slowly over time I rock behind. I get to the point where I feel 2, 3 out of 10 experience. Now I'm on the sixth week, so I can go a little bit more to the 4, 5, and I wait and take nice big breaths. Okay, that was around 2 minutes. 2 minutes seems like a sweet spot for now. I don't recommend to stretch for longer periods of time. Obviously, when someone is healthy, he can keep or she can keep even 10 minutes of a certain position and do certain exercises in this position. But right now, 1 week after the surgery, it's not really advisable. So 2 minutes, there is no really need to push for more. Let's stretch the opposite side of the wrists. All right, okie dokie. Now I understand that even this position may be impossible to get to for a lot of people. You can do it on the table while standing. No problem with that, or against the bed. I had a cannula here for a few days after the surgery, and even though it's not my first stretching, I still feel this area opening up. So unfortunately, the areas where the cannulas were, where the scars are, they will need a lot of stretching. Now the ankles, the Japanese squat. Okay, and now that's the cramp. So I would recommend to slowly sit down, find where your limit is, and check how much you can tolerate. You can use a pillow here, a pillow under your feet, whatever it feels comfortable and necessary. Now the other side, here we have to stretch one by one. Let's stretch the neck now. All right, let's do something for the hips right now. Feet together, as close to the pelvis as it's comfortable. And right now it's enough like this. Over time I can push a little bit, push my knees a little bit down. Okay, the last time I was interrupted. I couldn't continue, I couldn't finish my stretching, so I will do it now. What to do live on the farm? There's always something to do and I am always called to do something. So let's finish. We did adductors, let's stretch the quads and psoas, hip flexors. To do it, you will need 2 pillows to make your knee feel comfortable, and a lot of people will need some chair over here to get some additional support. You get to the position like this. You put one of your feet on the couch, on the chair, what it can be, whatever is comfortable, and then you bring your knee down on the pillows, and then you try to bring your knee as close to the couch as it's possible. Majority of people will start somewhere here, feeling a lot of stretching here, which is great. You aim for 2, 3 out of 10 stretching, and then just hold it. After 45, 60 seconds, everyone will notice that some of the tension relieved, and you will be able to go a little bit higher. The most common mistake is that people do something like this. Here in this exercise, it is convenient to hunch the back a bit. All right, as you see, I was wiggling a bit. That's why this chair here can be very, very helpful. Let's give some attention to the glutes. We'll do a pigeon pose, which looks like this. One of the legs ends up on the couch, on the bed, the second on the pillows that we already prepared, And the exercise looks like this. Basically, the knee is bent quite much. If anyone would have the knee too open like this, the ligaments in the knee will very quickly become unhappy. So this is a better position. Here we want to open the chest, and a lot of people already will feel nice stretching somewhere around here. And to increase the stretch, we want to bring the belly button to the thigh, to the knee direction. And it would look like this. Alright, majority of the work is done. Now time for hamstrings. A lot of people will not be able to get to this position, so it would be worth to start somewhere here and slowly allowing the heels to straighten up. If you feel a nice stretch over here, that's perfect. 2, 3 out of 10 intensity. If you are able to have your knees extended, you can try to bring your belly button towards your knees. Alright, that's good for head. Doing something like this is very good for head. I believe most of these things are safe for everyone after a week of surgery, a week after the surgery. I really hope that no one will mess up their health through them, but I believe strongly that if those rules that I mentioned in the beginning will be kept, it's super safe. Obviously, the biggest harm is always in intensity, but it's like with food, right? You can enjoy food, it's necessary for life, but if you will overeat, it will mess you up. So obviously, overeating after heart surgery doesn't feel nice, and hopefully your doctor already told you, and this is not about that, but I have no idea where to mention that. Overeating is a big burden for the heart in the first few weeks after the surgery. This is what I noticed. So basically, for the first few weeks I was on the keto, so there was no problem, but then I moved to the more carbohydrate type diet: potatoes, meat, salad, and then some dessert. And the mix of that, when it's heavy on the stomach, it's heavy on the heart. So yeah, it doesn't feel nice. You got this advice as a promo, like something additional. You're welcome. So that's the last video I am recording in Siemanówka in Poland. Tomorrow I fly to Dubai. That's going to be a different chapter, the next chapter of my recovery, the chapter where I already work a bit. The chapter where it's much hotter, where the nature is not so excellent as here, but a chapter that I have to start, and it's because that's where my life is currently, that's where my wife is, and I miss. It's time to do it. We will see how it will go. See you guys.